There are some problems that are so embarrassing, it's hard for people to talk about them even with their doctors. And for women, one of those problems is pelvic pain and pain during intercourse. And fortunately, I'm here with an expert, a gynecologist and a practicing gynecologic surgeon from Louisville, Kentucky, Dr. Lori Warren. Thank you very much for being here.
Thank you for having me.
And I think we got to start off talking about this by just defining a few words, some basic vocabulary. What are some of the words people need to know to even think about this?
Well, there's a word called Dyspareunia, which means painful intercourse or painful sex, and it's important to understand what that is. And it can be due to different reasons that we'll talk about.
And then there's some other words. Vulvodynia, what does that mean?
So vulvodynia means pain at the vulva, and the vulva is at the opening of the vagina. And it's usually due to the sensitivity of the nerves, and it can be very difficult to diagnose. It causes almost a chronic or constant burning or raw feeling. Some women feel like they're actually sitting on a knot, and they're very uncomfortable, and they keep going back to their gynecologist and being treated, sometimes for chronic yeast infections, but really it's this hypersensitization or sensitivity of their vulva that causes chronic pain, and that obviously would cause painful sex.
And then the third word that people may not know is vaginismus, and define that, please.
Vaginismus means that you're having painful sex due to a tightening of the pelvic floor muscles. And those pelvic floor muscles tighten up, and it's very difficult to have intercourse without pain. And that can also be due to different reasons. Okay, so now
we have the words defined.
Right.
Now let's take us through a hypothetical person, a young woman, say, because this is often women who are young, and of course there are other problems in women who are postmenopausal, but let's concentrate on the young woman who comes in, and maybe she's been at home just too embarrassed to even talk to anybody about it.
Right.
She comes in, finally she gathers up enough courage to see an expert, and what's the first thing you ask?
Well, she's telling me that she's having painful intercourse, and of course that's very concerning because it should be a pleasurable experience. So that's our goal. We want her to have pain-free intercourse. And so I find out, is she able to achieve intercourse from the beginning? Did it happen initially? Or is it something that happened over time? Because that can signal different etiologies or different reasons that she's having the pain. So if I want to make sure on physical exam that her hymen is not too tight, that's the hymenal ring or at the opening of the vagina. If she was using tampons without difficulty, things along those lines.
And if there's a problem there, what can you do?
Well, there's a very minor procedure that you can do called a partial hymenectomy, where you just loosen up or open up the hymenal ring, and once that heals, then women are able to have intercourse. If it happened more over time, you want to think about, does she have a vaginal infection that's causing irritation and pain? Are there any psychological issues that are going on, in her relationship? That would be more the vaginismus with the tightening of the pelvic floor muscles.
So that the vaginismus can be an anticipation of the pain that's going to happen?
Exactly.
Or that she thinks is going to happen?
If there was an insult, especially with the word vulvodynia, which means painful vulva, if you always have irritation and pain there, you're going to anticipate that sex is going to be uncomfortable, and you're going to involuntarily tighten up your muscles, and that actually is a vicious cycle, because as you tighten up your muscles, then it makes the nerve pain worse, and vice versa.
Now, I assume, obviously, there's treatment for an infection. What about for vaginismus? What kind of treatments can you do for that?
Yeah, there can be some psychological treatment that, depending on the reason that they're having the pain, you can really work with physical therapy and biofeedback. If it started with vulvodynia, you can sometimes treat the nerve endings. There's different medications that we can use, oral medications that can help.
So what is it like when you finally get to the answer and you give them a solution?
Well, they're all different. Sometimes they're frustrated because they've been looking for treatment, and maybe they've been from doctor to doctor to doctor, and they're not getting any answers.
Because doctors aren't really well trained in this? Is that,
it's very difficult to diagnose sometimes. And sometimes they're just embarrassed because they feel like they're not normal, that this shouldn't be painful for them. Sometimes it's really affecting their relationship with their partner. And so you have to take all those things into consideration. And then also think about, we've talked a lot about pain at the level of the vagina, but you also have to think about deeper pain. If they're having deeper painful sex, it could be due to problems with their pelvic organs, which are the uterus and the ovaries. There's something called endometriosis, that's very classic to have painful intercourse with endometriosis, and you may need to diagnose that.
Well, I think what you've basically made very clear is that there are a lot of different causes of pain during intercourse and of pelvic pain, and that there are actually treatments that women can have. And the very worst thing that people can do is to sit home alone and suffer in embarrassment. So thank you so much, Dr. Lori Warren, for
Well,
coming and
thank
talking
you.
about such a difficult and important subject.
Well, thank you. I hope it was helpful.